Hey friends, welcome back to the channel. My name is Majid and I'm a fourth year MBBS student from India. In this video, we'll be talking about how you can become a practicing doctor in Australia. Australia is very sought after pathway to become doctor because it brings a lot of benefits with it, like work-life balance, the salaries and the working conditions, and most importantly the competition, because UK, US, Canada, India and most of the countries are saturated with doctors, but in Australia there is a demand for doctor as of now. I have divided this video into 7 categories, the timestamp of which I'll be providing in the video. So looking at the broad categories I have divided this video into, first one is benefits, pathway, exams, residency training, salary and lifestyle, the cost, and visa and immigration obviously. So in benefits, we'll see the benefits that residency training from Australia brings. We'll see number of pathways that you can follow to become resident in Australia and become a doctor eventually in Australia. It does not have single pathway, but there are numerous pathways, exams that you need to sit for to become a resident in Australia, the salary and lifestyle Australian residency brings with it, the cost it incurs to become a doctor in Australia, and the visa and PR status and how to get it. So the first thing first, let's talk about the benefits. The degree is globally recognized in countries like UK, Canada, Middle East, Singapore and even New Zealand. So you can get the degree and apply for job anywhere in these countries and maybe even more countries. So the next point is the AMC pathway or Australian Medical Council pathway is a very affordable pathway, unlike a USMLE and PLAB where you spend a lot of money. Especially in USMLE, you spend approximately 20,000 US dollars or 20 lakh Indian rupees, and yet you're not sure you'll be getting a seat in residency or not. But here it's not the case. Let's talk about the salaries. The junior residents or non-PGJRs we call in India, they get around 60 to 80,000 Australian dollars per year, and the GPs, general practitioners, earn around 250 to 300,000 Australian dollars a year, and the consultants be earning 350 to anywhere around $500,000 Australian dollars a year. And private practice is allowed in Australia, unlike countries like UK, USA. An average doctor earns $1 million a year. Can you imagine? The next benefit is you can immediately apply for green card in Australia after just 2 years of registration with AMC, and you can also apply for citizenship within 1 year of PR, and actually you can get the citizenship within 1 year of applying. Now let us talk about the pathways. So there are basically 3 pathways: standard pathway, competent authority pathway and specialist pathway. So the standard pathway is for recent medical graduates in final year, or they are in their internship years or have just graduated a year ago. They can apply through standard pathway. Then there is a competent authority pathway. This pathway is for individuals who have already given exams of some other countries like PLAB, USMLE, licensing exam for Canada or Ireland, and they can bypass AMC exam and directly come to Australia and get registered and work as a doctor. Then there is a specialist pathway for obviously the people who are already specialists and they want to work in Australia. Let us discuss the standard pathway in detail now. This is the basic pathway, and I guess most of the viewers would be applying through standard pathway because all of us are still in med school or maybe recent medical graduates. So now let us discuss the standard pathway. So for this pathway, first of all, you need a medical school eligibility check, which means your degree from the medical school must be eligible. So for this you need to go to the AMC website, which I'll be providing the link for, and visit that website and you can check for your med school. If your med school is listed in that website, then you are eligible to pursue AMC pathway. The next point is open EPIC account. EPIC is the same body that verifies your identity and verifies your medical school degree. It is controlled by ECFMG, the same body that does for USMLE students. Once you're done with EPIC verification, you need to establish an AMC portfolio. On the AMC website, open your own account and upload all your documents, your medical school degree and your CV. Then there will be an EPIC medical school degree verification or primary source verification. Now it's time for you to take AMC part 1 exam. This will be an MCQ exam. Now you can actually apply for paid job directly after AMC 1 exam, which is not in case of USMLE or PLAB, wherein you have to sit for step 2, step 3 or PLAB part 2, only then you can apply for a job. But here, after you write AMC part 1 exam and you pass it, you are eligible to apply for a paid job. The process is, first of all, they'll call you for interview, and then if you pass the interview, they send you the employment letter and you get a limited registration for 1 year as junior medical officer, and the salary will be anywhere around 60,000 to 80,000 Australian dollars per year. Now you give AMC part 2 clinical exam. This is actually a clinical exam, an Aussie based exam wherein there will be 16 to 18 stations. 16 stations are for your practical skills or clinical skills, and 2 stations are your rest stations. Or you can also bypass AMC part 2 exam by doing a WBA, which is workplace based assessment. I'll be talking about this later in the video. Now, after you pass your AMC part 2 exam, you do a provisional registration and you can start 1 year internship job, which is a paid job, which has a salary similar to that of a non-PGJR, 60 to 80,000 Australian dollars a year. Now coming to general registration, post internship of 1 year, you apply for a general registration, which is a complete registration, and then you apply for a residency. Residency is for 1 to 3 years here in Australia, but this, mind you, is not the residency. As you all know, this is not PG. I'll be talking about this later in the video. This is actually a core training as done in the UK. After your FY2 year, you sit for 3 years of CT, which is core training, and then you go for ST, which is specialty training, for 5 to 7 years or something. After 1 to 3 years of residency, you do registrarship, which is again 3 to 6 years depending upon the field you choose. This is equivalent to PG in India. In this you can choose various fields like internal medicine, OBGY, pediatrics. And now after you finish your registrarship for 3 to 6 years depending upon your field, you become a consultant. Now the second pathway is competent authority pathway. In this, medical graduates from Canada, USA, UK, New Zealand and Ireland do not need to write AMC exam. So basically they can bypass AMC exam and directly go for their professional registration. Following are the authorities that are competent enough to bypass AMC exam: GMC from UK, Medical Council of Canada, LMCC, USMLE for United States of America, Medical Council of New Zealand, NZREX, then Medical Council of Ireland, IMGs with PLAB and USMLE. Obviously, medical graduates from India, Pakistan or other countries who have passed and qualified PLAB and USMLE exam respectively, they are very much eligible to bypass AMC exam as well. But there is a catch in this pathway. In the competent authority pathway, if you have done a degree from New Zealand, Ireland or UK, then you have to perform 1 year of supervised clinical training in the respective country, and if you have done your degree from USA or Canada, then you need 2 years of supervised clinical training in those respective countries. Only then will you be eligible to apply for a provisional registration through AMC pathway. So the third pathway is specialist pathway. For this pathway you need to be an IMG obviously, and you must have a residency training plus or minus fellowship. If you have a fellowship, you are on an upper hand, and then you need a 3 years of clinical practice post your specialization in the respective country from where you have done your specialization. The criteria to apply for specialist pathway is you need to have a eligible medical school degree, and you need to check your college obviously on the AMC website if the medical school is listed in the eligible list of schools. Then you need an EPIC account and identity verification, and you need to do a primary source verification obviously. Then you need to apply to PG or specialty in the respective country. Then you need a verification of specialist degree after you have done your degree, and then there will be an initial assessment wherein you will upload your CV and there will be an interview call for you, and you need to actually pass that assessment. Now let us look at the exams, which is the most important part. So there are basically 2 exams, AMC part 1 and AMC part 2. So now we are discussing the AMC part 1 exam. It is an MCQ exam and clinical knowledge based exam, unlike USMLE step 1 and PLAB part 1, which are actually basic sciences based exam. They test for your knowledge in basic sciences, but here AMC Part 1 will test for your knowledge in actual clinical knowledge. For this exam, you need to cover important subjects like anatomy, physiology, pathology, microbiology, third year subjects like ophthalmology, ENT, then you need your radiology, orthopedics, pediatrics, OBGYN, and also medicine, most important of all. It is an MCQ based exam having 150 multiple choice questions, and the exam is of 3.5 hours. It is online exam and there are centers worldwide. It is also considered by Pearson VUE, which is a body that conducts MRCS, MRCP exams also, that I've talked in my previous video of MRCS. You can check it out from the I button above. This exam has 3 months wait period for getting a slot, unlike the PLAB, which my seniors who have given say it is 12 to 18 months. So you can see the competition that PLAB brings. I mean, the number of doctor influx in UK, USA and Canada are insane, and you know NHS is going into a medical crisis right now. Doctors are underpaid, there is strike across the country. I would say AMC, Australian Medical Council, provides a better pathway for becoming a doctor and leading a successful career. Coming back to the exams, this exam has unlimited attempts, unlike USMLE, in which if you fail for the first attempt, you need to wait for 7 long years to get another attempt. There is no negative marking, which is the best part. Unlike NEET PG, there is -1 mark for every wrong attempt. So there is no negative marking in this exam. The score is valid forever. You can avail paid jobs directly after Part 1 AMC exam in Australia if you want to explore how things work and how hospitals are run and how everything works in Australia. So this is the best thing, and it is a paid job obviously. This exam is scored from 0 to 500 marks and the passing score is 250, which is 50%. It has 60% pass rate, but there is a catch in this. When I spoke with my seniors who have given AMC exam, I came to know that most of the students who sit for AMC exam are actually having a gap period of 2 to 3 years in their career after their graduation. So it is not a fair way to judge for the pass rate, because if you are fresh graduate, if you have just passed your MBBS, so your knowledge is fresh and you are in a momentum and you can easily crack those exams like AMC Part 1. And the students who are sitting for competitive exams like NEET PG and USMLE, it is really easy for them to pass in this exam. And also there is no IELTS or OET exam as a prerequisite to sit for AMC Part 1 exam. Unlike for PLAB exam, you needed to have an IELTS or OET exam. Now coming to the study materials, you can refer to books such as John Murtagh's Handbook of General Medicine and official AMC handbook. Then for question banks, you can refer to AMEDEX or AMC question banks. Refer to previous year's recall questions from the students who have given the exam. The preparation time needed for this exam is actually very less as compared to other exams like USMLE and NEET PG. If you are very well versed with your basics in medical school, then you need to give 2 to 3 months maximum. But if your basics are weak, then it might take 4 to 6 months. Now let us talk about the AMC Part 2 exam. So this exam is an Aussie based exam, which is objective structured clinical exam. So it is a clinical skill exam. In this, your clinical skills will be assessed in subjects like medicine, surgery, women's health, pediatrics, psychiatry and social skills like community medicine, we call it in India. In this exam there are total 20 stations, of which 16 are clinical stations and there are 4 rest stations. Each station is approximately 10 minutes. 2 minutes of reading time and 8 minutes of clinical assessment. This exam is overall of 3.5 hours again. This exam can be taken worldwide, anywhere in online format, or if you're doing it in offline format, then you have to visit Melbourne in Australia, NCT office. The wait period for this exam is a 6-month period to get a slot. If you book today, you might get a slot for 6 months from now. This exam again has unlimited attempts. There is no negative marking and the scores are valid forever. Now this exam has a 28% of passing rate, which is again I would call catch over here, because people have a lot of clinical gap between their graduation and their attempt to the exam. If you are a fresh graduate or you are an intern right now, you can easily crack this exam in a go. Now since AMC Part 2 exam has only 28% of pass rate, you can always go for an alternative, which is workplace based assessment, but it is very difficult to get through it. Now coming to the study material, you can refer to books like AMC Handbook of Clinical Assessment, Karen's Notes, AMC Medical Marvin Notes. I'll be mentioning their links in the description. You can refer to question banks from Amidex or AMC question banks. You can compile those question banks and make your own question bank at the end when you study. You can always watch videos for clearing your doubts and getting a better insight to the topic. You can watch Tally O'Connor's ed exam videos, Geekymedics on geekymedics.com. I'll be providing their links in the description. The preparation time for this exam is 3 to 4 months, 8 to 10 hours a day. Actually, it's very variable. It depends on how strong you are in the subject, what are your weak and strong areas, and how strong your basics are. Now coming to the OET and IELTS exam, it is English proficiency exam. You can take OET or IELTS. These exams are not required to sit for AMC Part 1 or Part 2 exams, so you can bypass this exam initially and directly give AMC Part 1 and Part 2 exams. OET and IELTS exams have centers worldwide, and you need a minimum score of B in the 4 components, which are listening, reading, writing and speaking. IELTS is an academic exam, whereas OET actually is an occupational English test, which is actually made for medical professionals. The terminologies that you use in OET exam are medical terminologies mostly, so it is a better exam. For IELTS, you need overall of 7 and a minimum score of 7 in each 4 components, that is listening, reading, writing and speaking. Difficulty wise, IELTS is more difficult than OET, but I would say expense wise OET is more expensive than IELTS, so you need to negotiate between the difficulty and expense. Now let us see how residency pathway is structured in Australia, the different terminologies you need to understand. So first of all, there is university or medical school for 4 to 6 years in Australia, and then there is 1 year mandatory internship, which is PGY1. So you need a provisional registration before applying for internship in Australia, and you can get provisional registration only by sitting for AMC Part 1 exam. So first of all, you need to write your AMC Part 1 exam, you need to get the provisional registration, and then you can apply for 1 year mandatory PGY1, which is internship in Australia. Now you need to give AMC Part 2 exam, and then you will be given a general registration or complete registration, and then there will be residency of 1 to 3 years. This is not a PG, this is not a specialty degree, this is just you rotating in different fields of medicine. After this, you need to apply for registrarship, which is again 3 to 7 years. This is actually your residency, or PG you call it in India. In this, you actually choose a field of your specialization, like internal medicine, OBGYN, pediatrics, orthopedics, whichever you want to pursue, whichever you are interested in. Before this, wherever you were rotating, you were broadly called as junior medical officer, but now you are called a registrar. After this, you do a fellowship or you become a hospitalist. So the total training duration comes to about 5 to 9 years, which includes 1 year internship, 1 to 3 years of core training or residency, which you call in Australia, 3 to 6 years of registrarship, which is a specialty training. And now let's talk about the work-life balance. You need to work 5 days a week, 40 hours per week, and there is compensation for overtime, obviously. We'll talk about it later in the video. There is a 5-week paid vacation per year. Also, there is no 24 hours call shifts like in the US and India, where the shifts goes on for 24 hours to 48 hours or even the next day. Now let's talk about the salaries. So the intern base salary is 60,000 to 80,000 Australian dollars a year, which is around 1,350 Australian dollars per week. And for this, you need to work 40 hours per week. This is the minimum that you need to work. So hourly payment is 33 Australian dollars per hour, and the salary increases every year by $10,000, and the salary of same position increases by 2.5% every year, keeping in account for the inflation. Now obviously, if you work overtime, you are paid extra. If you're working more than 40 hours, then you will be getting 1.5x the base pay for the first 2 hours, and then for the next hour onwards, you'll be getting 2x the base pay. On the Saturday, if you are working, then you'll be getting 1.75x the base pay, and on Sundays it increases to 2x the base pay. And on the public holidays, you will be getting 2x the base pay plus 1 day off additionally. Now let us see the average salary at each level in your career in Australia. So the average salary of a doctor in general is 300,000 to 1 million Australian dollars a year, and for general practitioner it is approximately 250 to 350,000 Australian dollars a year, and consultants earn anywhere around 350 to 500 Australian dollars a year. And if you're in private practice, you earn yourself a fortune. You earn more than $1 million Australian dollars a year. So if you look for the consultant salary, it is 300,000 to 500,000 Australian dollars a year, which if I equate it, you will be earning more than doctors in US. It's like wow. Now let us see the cost of doing this pathway for Australia. All the three pathways have different cost. So let us see the standard pathway first. Medical school eligibility check, that is free. Then you open the Epic account, which costs you around 200 Australian dollars, and to establish AMC portfolio, it will cost you anywhere around 600 Australian dollars. For primary source verification, it costs you around 154 Australian dollars. Coming to the AMC Part 1 MCQ exam, this is hefty amount, 2920. Approximately 3,000 Australian dollars. Now after this, you can, as I said, work as a PGY1 or non-PGJR. For this you need employment letter and limited registration, and you need to work for 1 year as junior medical officer, and it will cost you around $1,855 to do all the process. After this, you give your AMC Part 2 clinical exam or WBA, workplace based assessment. If you take the AMC Part 1 exam in online mode, it costs you around 4,130 Australian dollars, and for offline it is 3,730 Australian dollars. And WBA, workplace based assessment, is really cheap as compared to other pathways. It will cost you around 1,000 Australian dollars. But I would say WBA is pretty tough to get in Australia unless you have very good connections with consultants. After AMC Part 2 clinical exam, for provisional registration, it will cost you 920 Australian dollars, and general registration will again cost you 1,855 Australian dollars. So the total cost without limited registration, which means if you're not working as a junior medical officer, it will cost you around 10,800 Australian dollars. And if you're working as a junior medical officer, so if you add the registration fees of getting the employment letter and limited registration, then it is around 12,600 Australian dollars. Now let us see for the competent authority pathway. The medical school eligibility check is for free. Then you open the Epic account, which will cost you around 200 Australian dollars, and establishing AMC portfolio will cost you around 600 Australian dollars. Then Epic verification will again cost you 154 Australian dollars. Provisional registration 920 Australian dollars. General registration again 1,855 Australian dollars. So the total cost for competent authority pathway is 3,700 Australian dollars. Now let us look the cost of specialist pathway. Initially everything is same. So you will be paying primary source verification amount $308, which is double because obviously you are verifying 2 degrees. In competent authority and standard pathway, it was 154 Australian dollars, but here it is 308 Australian dollars for 2 degrees. First one is your primary medical school degree, and the second one is your specialty degree. Again, limited registration 1,855 Australian dollars, and specialist registration is 2,495 Australian dollars. Now let us see the visa and immigration rules. For Australia, there is a work visa. It is called Work Visa 482, which is also called Temporary Skill Shortage Visa. It is a 2-year visa and can be extended for 2 years. You can apply for green card immediately after your full registration. Like average, it takes only 2 years to get your green card or PR, which is wow. If I'm supposed to take a PR in USA, I'd be spending around 14 or 15 years because the number of Indians and Pakistanis and immigrants in USA influx at a very high rate as compared to Australia. You can get the citizenship within 1 year of permanent residency or PR, and this opens the door for your private practice wherein you can earn more than $1 million Australian dollars a year. So guys, thank you for watching the video through the end. If you like the content, please hit the like button and also subscribe to the channel if you want to keep watching the contents like this.